only way to respond to a thing of beauty is to put your thoughts out onto the page. Two years ago, I've been diagnosed with a rare form of abdominal cancer located in the duodenum. It was a difficult diagnosis. Over a short period of time, the reality of my health became more weight-bearing. And even in the quietest place I've ever been to, it was difficult for me to find what you can call real peace. When something like that happens, your values change and things take on new significance. And so did music. The piano became a refuge to me. Music brought hope and connection. A larger family emerged before me as did a humbler sense of self, with more gratitude for just being alive today, surrounded by the treasures of my life and my family. This piano was a gift from my father. I was so depressed at the time, I can't remember, and then he just told me, "Hey, take this, why don't you try it?" And then I discovered that music like It's a Wonderful World, Amazing Grace, and even Jello can change us.
First of all, I want to tell you what traditional medicine is. It's another kind of medicine that includes methods that are not part of conventional medicine. It's a way to improve the quality of life of the patient with cancer, and it's important to don't forget that it doesn't have to work with like the only treatment. It has to work like a complement with the conventional medicine. There are some advantages of this kind of medicine. First, it uses organic components, so it's a way to avoid the constant exposure to chemicals or pills. And it has fewer side effects, and it's the main reason why it has been assessed by more people around the world. About the types of treatments against the cancer, I like to mention the most important that are, for example, proven treatments, research treatment, research complementary treatment, comprehensive therapy, and alternative treatment as the most important, of course.
3 years ago, I went to a party. There I found some friends that were smoking. In that moment, I decided to smoke for both. Every day, I smoked 12 cigarettes. When I was stressed or nervous, this helped to calm me. It was a necessity. I smoked a lot. In August 2014, last year, I observed that I was not the same person. I was feeling so tired. My mom and I visited a doctor. It was there that I discovered that I have cancer in the lung. And if I don't follow the treatment, I could lose a lung. I felt very sad. There, I understood that luck doesn't mean you being better. Now I am in treatment, and I appreciate the advice of my parents. Every Sunday, I visit a rehabilitation center. This place assists me a lot to change my attitude.
cascading run of malignant cells in this organ, and if not diagnosed early, can travel to other organs of the body. Its main causes: the smokiness, with its high concentration of carcinogens, goes directly into the air and inhaled by both smokers and non-smokers. Other is genetic predisposition. It is known that cancer can be caused by mutations of DNA that activate oncogenes and make inactive tumor suppressor genes. Other is marijuana. Marijuana cigarettes contain more than the snuff. Similarly, the smoke is inhaled deeply and retained in the lungs for a long time. The symptoms is cough or chest pain that doesn't go away and may be accompanied by expectorating, and whistling, breathing, shortness of breath, coughing of blood and sputum, hoarseness or swelling of face. Surgery involves removing the tumor and some tissues from the surrounding area, and is often used in the early stage of the disease. Chemotherapy uses drugs to kill cancer cells. Radiation therapy using high-energy X-rays to kill cancer cells and shrink the tumor. And about the prevention is the most important part. The main way to prevent lung cancer is to stop smoking and avoid smoking snuff in the case of non-smokers.
Well, it's hard to imagine how it feels when someone is diagnosed with cancer. Sometimes the life is hard and the only way to moving forward is to be strong. 2 years ago, I was diagnosed with cancer. I began to feel swelling and severe pain in my stomach. That was when I had surgery and discovered that I had a tumor. It was very difficult for me, very difficult for me. I began to despair, to feel fear. It was a flaw in my life because you can't imagine that this decide can happen to you. It's really hard. Well, something happened. I feel that my family suffered a lot for my disease, and I didn't want them so. My family was what made me stronger. This totally changed my life. But now I am here, strong, and moving forward.
Now I'm going to talk about cancer and its psychological point of view. But first of all, I'm going to make a little introduction about what is psychological stress. Well, it is a feeling that people experience when they are under mental, physical or emotional pressure, and although it is normal to feel it from time to time, it becomes a problem when people start to experience it for a long period of time, because they may develop some health problems and their immune system can be weakened, so they are more prone to viral infections. Now, during cancer, the mental health of patients depends on 3 important factors, which are the time of diagnosis, the amount of pain that the patient is suffering, and the type of cancer that the patient has. So, patients with cancer suffer in 3 different ways. First of all, the emotional way, because they feel more anxious, they are depressed, they feel angry with themselves, and their families are worried because they don't know how much pain the patient will have to endure. Now, if we talk about the development problem, that is because they can suffer from a kind of discrimination because people do not know how to act in front of them, and they don't know what to do in their everyday life. Also, finally, the financial way, because the treatments and the drugs are so expensive that they are not covered by the insurance. So it becomes a problem to the family and to the patients, so they develop some kind of stress. So in order to cope with this kind of stress, during and after the treatment of cancer, they have to go to therapies. They can go to a talking therapy so they can release their worries and fears. They can go to an educational therapy so they can learn more about their disease. They can also, and they must go with their families to a therapy because they need to know that their family is with them, that they are not alone. And also, they must go to a psychiatrist because in some cases they need medication for their depressions. And they need to exercise in order to be more relaxed. And